It's a real honor to have presentation here today. Today my topic is the future of varicose vein treatment, and actually it is very difficult topic for me because I don't know even my future, but of course I don't know the future of the varicose vein treatment. So I prepared this slide on my way, and I think there must be some shortcoming of my slide, and please understand and listen easily and simply, and I'll finish it quickly. Okay, as we know well, the history of varicose vein treatment start from the surgical ligation and stripping 100 years ago. And about 40 years ago, ultrasonogram was developed. And about 20 years ago, the RFA and EVLA, the thermal treatment were developed. And recently, 10 years ago, the non-thermal treatment was developed. So there are three categories of modality these days, and evolution from surgery to thermal to non-thermal these days. And so what should be if we think about the new treatment? So I think new treatment should show the following content. So I think the important thing is less invasiveness and less pain. It means faster recovery for patient, and also better outcome or less complication, or faster treatment and faster treatment technique for a surgeon, and also better cost effectiveness for patients. So I think we can think about three categories for the future varicose vein treatment. We can make the upgrade with the pre-existing modality, and second, we may mix and help each other with pre-existing modality, and last, maybe there will be a real new technique concept. So I'd like to introduce the upgrade modality. I think most of you already heard about the name Varithena. It is polydocanal endovenous microform, the name Varithena, and if we search the PEM through PubMed, we can find the article about more than 20 articles, and there are some show only good result and good efficacy with early result. And also we can find the IFU through Google, and it used polydocanol scourgeant and 1%, and the solution combined 1:7 ratio with carbon dioxide, and use not more than 15 cc per single session treatment, and injection the foam slowly about 1 cc per second speed. So I heard that I asked the company, and they said the Varithena is not approved in Korea, and the company did not start the approval procedure yet. So I think in Korea we need to wait more than 2 or 3 years more to meet the Varithena. And also we can think about the upgraded the pre-existing equipment. For example, the MOCA, the name, the Clarivine, we know there are some shortcoming with the device, some catheter, wire catheter, sometimes stuck in valve, and sometimes some issue with the battery, and also for a beginner, it's not easy to do the injection, rotation, and pullback. Sometimes not easy. And also the cyanoacrylate closure technique, the Venacil, we know that there are some issue with the gun problem, some shooting error, and also there are some hypersensitive reaction with the glue material. So I think, yeah, the NTNT, the two modalities are very good and novel technique, but some shortcomings are still. So in the future, maybe some upgrade NTNT treatment will be. And also, we can expect some mixing. It means we know there are three kinds: the mechanical, thermal, and chemical. So the MOCA is mixing with mechanical and chemical. And however, we also think about mixing with thermal, chemical, or mechanical, thermal, or thermal, mechanical, chemical. So maybe the pre-existing three type of thermal, chemical, mechanical, maybe mixing and help each other in the future. And the last, the real new one, I think some of you already heard about it. The commercial name Sonovane is a high-intensity focused ultrasound device, the HIFU device. So we know that the HIFU is already used in oncology field, for example, the uterine myoma, and it's kind of some energy device, so makes some thermal damage to the structure. It's kind of actually thermal treatment, and there are not. I cannot find some well-designed study yet, but I can find through YouTube some the video, and in USA, the clinic, Whiteley Clinic, I think the clinic do the Sonovane, and you can find some simple video about it. So as I told you before, in the future, maybe some new treatment will be evolved, and I think the new treatment should follow the less invasiveness or better outcome or less complication and faster treatment and better cost effectiveness. So, and this is the last slide, and we know that the varicose vein is definitely a genetic problem, so I'm not sure, but maybe in the future some prevention or gene therapy can be evolved. Thank you.